Well, certainly I have learned from this conference that there is the readiness on the social policy side to engage in this process and to support this process. And the other key point was the constructive role that the user empowerment can play in this, and the importance of involving users in developing new and better solutions, both in shaping care but also in shaping the social environment for users, but also for communities as a whole.
Well, I'm not the organizer of this conference, so I can't answer that. I mean, in my view, the users should have been much more prominent here.
This is a long process that I've been involved in for a long time. At least I felt at this conference we were properly represented in that we were enabled to be here, not as much as we could be as we have no money, but the messages we had to say were listened to, I would think, more at this event than they have been in previous events. Previously, the European network has been considered to be just difficult service users moaning all the time. Moaning, making groaning about the system. Now we're considered to have more of a positive attitude about how things could be better. It's a long way to go, and I'm not saying that it's perfect. It's not. We were 6 people here out of a conference of 200. Yeah. There may be others here who are service users and doctors, but they don't feel able in a stigma discrimination conference to say, I am a mental health service user and I am a doctor. Yeah. It's sad, I think. I can offer this, as my badge says, expert by experience. And I'm self-employed as a mental health user consultant, but that is too many words. And it just means that we are experts just as much as any other experts. The EU is forever, always uses panels of experts, and we need to be considered to be an expert to be on the panels. You know, we have to join them in their way of working because we are too small at the moment to force them to join our way of working. We have a lot of power, but we are powerless.
What can the WHO and the European Union do to make the countries work together? What benefits would be from that?
Well, I think there's been some really interesting work by the WHO, and it's worth saying that the project on empowerment indicators that I've been involved in has been I think it's been a really good example of how service users and families have been involved. And at a conference that has almost finalised our indicators, 2/3 of the people giving presentations, 2/3 of the people sitting in front and talking as experts, 2/3 of those people were either people with direct personal experience or were family members. And that feels so different, for example, from this morning, where almost nobody was someone from from that background, and a lot of that is down to people like Matt Nugent, who has worked really hard to not just involve service users, but involve service users as experts, not to make up the numbers, but actually as researchers, as monitors of services, as providers of services. So, there are people out there who are acting in expert roles, who are using their experience to reinforce their expertise. And those are the kind of people which will help to shift the mind. I think at an EC level, at a European community level, that is still rarer. I think there is still quite a strong hold by clinicians. I think that it is still clinically driven rather than, if you like, rights driven. And that probably needs to change.
I mean, in my view, the users should have been much more prominent here, and my office organized a seminar in Brussels 2 weeks ago, which was called Forgotten Europeans, Forgotten Rights. It was not only mental health, it was disability, children and elderly. We tried to tie these empowerment narratives together with the common thread being institutions. how do we do away with the institutional model in all these categories of people, particularly, for instance, children in Central and Eastern Europe, which has a very, very high rate of institutionalization of children, which is very, very damaging, but also mental health. And there, on each panel, we had someone who represented the user perspective. We had panels of 4, and always one of the persons was a person who represented the user perspective. I think, frankly, that panels where you have 9 professionals and no users are anachronistic.
I would say that there is a legitimate role for user organizations to moan, because the criticism is also a necessary part in finding solutions. So, but I hope that after the moaning, that then there is also the part of the offering examples, offering pathways for good solutions from the side of user involvement. But we have seen much of that in the preparation of previous conferences of this one, so I cannot really complain.